Thank you.
Now, yesterday, Nazinda Denise was at the Uganda Cancer Institute to find out their plans for the future in facing the problem that is coming to Uganda in the form of cancer. Today, she visited the unfinished construction site of the cancer machine bunker and she filed this story.
Yesterday, we talked about the plans and what will comprise of the radiotherapy bunkers that are being built at the Uganda Cancer Institute. Today, we look at how far the construction has come. Dr. Jackson Orem, the director of the Uganda Cancer Institute, gives us an estimate of how far the construction has come.
After the decommissioning, within 2 months, at most 3, we are going to be having the service back here in Uganda.
This radiotherapy machine that was purchased can only be brought in after the renovation and construction of the radiotherapy bunkers is complete. Ezra Nayoga, the resident engineer at the construction site of the bunkers, explains the challenges that they have faced while undertaking the 6 months project.
The issue of weather. The kind of construction we have has a rough foundation. Now, for this kind of foundation, the excavation leaves a kind of basin. That means that when it rains, water collects in there. And you cannot do anything until you suck the water out of the hole. So that's a challenge. So when it rains, it means that we have to spend about 3 days to clean the area. Challenge number 2 is traffic jam. The contractor has a batching plant that is off-site. Now, because we have to pour this concrete constantly, it means that we have to face the travel of concrete such that it's constant.
Uganda might be able to access modern facility treatment of cancer in the future if the plans to purchase better machines to treat cancer are successful. Dr. Jackson Orem, the director of the Cancer Institute, explains the future plans of the institute.
We are now moving ahead with the bunker for the modern machine, the so-called LINAC, and that is what we are witnessing today. So what I'm trying to say is that we are not only looking at restoration of service, we are looking ahead at actually now having in this country a modern treatment service for radiotherapy, and not only one. This bunker will contain 4 modern machines called LINAC, and then 2 high-dose brachytherapy machine for treating cervical cancer. Because as you know very well, cervical cancer is a very common cancer in this country, especially for women.
Even with the construction of the cancer bunkers in progress, some professionals still think that this will pose a challenge to the many patients undergoing treatment and the institute at large. Joseph Makoba, the leader of Young Professional Chronic Diseases Network Uganda, gives his view about the situation.
Many people die or don't get adequate care because these things are not prioritized. Now, for the bunker for the radiotherapy machine, the fact that a new machine was ordered and it can only be brought in when a bunker for it is constructed puts the bunker as a limiting factor for radiotherapy care.
With these and more developments at the Cancer Institute, many Ugandans are having hope that this will bring control of the disease in the country. Nazinda Denise, PM Live.